Let's talk about the shooter. So, obviously, we now know who the shooter of United Healthcare CEO Brian Thompson is, or we think we do. He's innocent until proven guilty, of course, but he is in custody, and the evidence is accumulating, and it's hard to believe. It's hard to believe that he's not the guy. It's possible, but it's hard to believe so. One of the things that we know is that the shooter, this guy wrote a manifesto, a short manifesto written by the suspected killer, and this is let's see. Okay. Okay, so let's read what he has to say. He writes, to the feds, I'll keep this short because I do respect what you do for our country. Oh, he's a patriot. To save you a lengthy investigation, I state plainly that I wasn't working with anyone. This was fairly trivial, some elementary social engineering, basic CAD, a lot of patience. The spiral notebook, if present, has some strangling notes and to-do list that illustrate the gist of it. So he's explaining, how he pulled this off. My tech is pretty locked down because I work in engineering, so probably not much info there. I do apologize for any strife or trauma, but it had to be done. We're talking about somebody who just killed a CEO in cold blood. I mean, very coolly, like a pro would. It is surprising. He says, frankly, these parasites simply had it coming. And he goes on, a reminder, right? The U.S. has the #1 most expensive healthcare system in the world, yet we rank roughly 42nd in life expectancy. So, okay, let's take some of the facts and, let's just note first, a lot of people now support this guy. He has become a hero to a certain, I think, subsection of our society. And I think this crosses political lines. I don't think this is just a leftist thing. I think it's across lines. They're now in New York City. I saw there's an article in the Wall Street Journal that there are now wanted signs in New York City, like wanted signs with pictures for healthcare executives and Wall Street executives. Just, wanted for crimes against humanity. The posters all over the place. They're also free Luigi. Luigi is the shooter. Free Luigi signs all over the place. If I were an executive in Wall Street right now or in an insurance company, I'd be worried. Hopefully they're beefing up security. I don't think we're going to see a lot of copycat shooters. It takes a lot for somebody to do this, and it takes a certain instability, emotional, mental instability to do it. Okay. So the hatred in this country of insurance companies, the hatred of our healthcare system. You saw this partially in my debate at Cambridge, but that was in England, but it exists in the United States. People hate insurance companies. They hate, one of the stories about the shooter is, about Luigi, is that he had lower back pain and he had surgery, and I haven't seen any stories that he was denied coverage or it cost him a lot of money or anything like that. I mean, I've had surgery. I had big surgery I've got screws in my back, and I had a fusion surgery in my lower back years ago. I mean, I had a private room in the hospital. I had fantastic care. I spent 5 days in the hospital, I think, because they had to actually do 2 surgeries to get it completely right. I spent hours and hours and hours on the operating table. I mean, I think the first surgery was like 9 hours, and the second was 3 or 4. Great care, great doctors, great nurses, really good hospital. And I don't remember what my out-of-pocket expenses were, but they weren't high. I mean, the insurance company covered it all. By the way, I'm pretty sure it was United Healthcare. They covered it all. I've had no, now maybe it's just I'm lucky, I have no negative experiences with American insurance companies, but I can imagine some people do. But for every person who's had a negative experience with an insurance company, there are tens of thousands of people who, got great care. Great care because of the insurance companies. It's a business. The other funny thing is about, these insurance companies, they make a lot of money off of you. But the profit margins of insurance companies are very low, something like 6%. Apple's profit margin is 25%. It's a highly competitive business. And it's an interesting business. Insurance companies are probably the ones who make the least amount of money in the healthcare supply chain. Doctors, hospitals are jacking up prices. Insurance companies are the ones trying to keep prices low, and their profit margins are pretty small. But we hate them. The fear is, of course, that this hatred is going to generate significant backlash against the American system and significant striving to socialize, to get rid of whatever private elements exist in it, to make it some kind of single payer, to get rid of the insurance companies, to get rid of the profit margin they have at all. And that will take the quality of American healthcare significantly backwards. So, I mean, he makes claims here about it being the most expensive healthcare system in the world and number 42 in life expectancy. So let's take those two claims first. Yes, the U.S. System is expensive. But when you compare the cost of healthcare in the United States to how much money we have, that is to the wealth of individuals, that is to the consumption behavior of individuals, then it doesn't look that expensive. Yeah, we pay a lot of money for healthcare, but we probably pay a lot of money for everything because we have a lot of money. So when you control for how rich a country is, we don't pay that much. And here, rich is not just income. It's not GDP per capita. I think one of the more interesting measures of richness is actual individual consumption per capita. I'm getting this out of an article by Cremiux, Cremiux, who kind of analyzes all this. He does a lot of stat stuff. Some of it I don't like, but a lot of it is very good. Anyway, the U.S. does not spend that much more if you take into account the fact that the U.S. is rich. On a consumption level, and how much we consume as individuals, we consume more than anybody else in the world, pretty much. Like Norway, I think on a GDP per capita is richer than the U.S., like GDP per capita. But because that GDP per capita doesn't actually make it to individuals, it's mostly in the hands of government and the oil business and a few big businesses. Individuals don't actually get it. It's just an average. U.S. individuals spend more money because we're actually richer than Norwegians, in spite of the fact that GDP per capita is higher in Norway. It's an interesting quirk of the statistics, which is worth looking at. Ireland, for example, has very high GDP per capita, but Irish people are not very rich, are not very wealthy, because most of that capital, most of that GDP is held by corporations that have their headquarters in Ireland, and then it's divided by the population as if that GDP gets distributed to the population, but it doesn't. In the United States, we, as consumers, have more of that GDP than most other countries. Our taxes are lower, for example. So you can look. We'll do a more in-depth analysis of the American healthcare system on another show to see why these fallacies are fallacies. That is, we don't spend that much more, and that it's basically an example of the fact that because we're rich, we can afford more. So, for example, I get an MRI every year, full body MRI, to make sure I don't have cancer. That goes into the stats for how much money the U.S. spends on healthcare. First of all, the U.S. doesn't spend it. I spend it. I spend it actually out of pocket. The insurance doesn't cover it. And I do it for prevention's sake, which is going to result in hopefully me living longer. Probably doesn't change the average life expectancy. And it seems, from the perspective of a bureaucrat, it seems wasted. It seems wasted because they don't find anything, hopefully, when they do the scan. I don't get any treatment. I just had a wasteful MRI that found nothing. The United States, for example, we have more surgeries. This is, again, from this article. More surgeries than anybody else. So we spend a lot of money because we have more surgeries. Why do we have more surgeries? We can talk about that for all kinds of reasons. But we do have more surgeries by a large margin, which explains a lot of why we spend more money on healthcare. And it's just not honest to blame poor life expectancy on healthcare. The reality is that much of the poor life expectancy has to do with drug overdoses. It has to do with, violent crime, which in many countries is much lower than it is. Homicides are much lower than they are in the United States. It has to do with accidents and alcohol abuse and a lot of other things, and maybe most importantly, it also has to do with obesity. It has to do with lifestyle. Lifestyle that is not determined by a doctor. You determine it. Too many Americans abuse their bodies and die young because they die unnecessarily because of self-inflicted diseases, because of lack of exercise and overeating and getting obese and all of that. So, so for example, John Hopkins life expectancy report says that 57% of the life expectancy gap between the US and the UK was because of cardiovascular disease. Another 32% was because of drug overdose, and 20% was because of firearm-related homicides and suicides, and 17% was due to motor vehicle accidents. So here you have drug overdose, firearms, and motor vehicle, explaining, what is this, 32 plus 20 plus 17. I mean, that's 60-something %, right? Now, I don't know, these numbers don't exactly add up. So, in other words, it has nothing to do with our healthcare system. Now, heart disease is true, but that's not because our doctors are not good. We don't provide enough drugs. We don't provide the good medicine. We don't screen. We do all that. We do all that. But what we can control, what we cannot control, is people's lifestyle choices. So 90% of the gap for men and 2/3 of the gap for women in life expectancy is explained by non-healthcare related stuff. Right. Generally, by the way, we do much better in the United States than Europe and UK and other places on things like cancer and cancer survivability. All right, so I will do a deep analysis into the U.S. healthcare system, how it functions, why we pay more money, what about the whole life expectancy thing. That deserves a whole show in and of itself. And of course, we have to remember that what we have in the United States is far from a free market. We have a heavily regulated healthcare market, which is far from free. I mean, the killer in this case was not a United customer, not a United Healthcare customer from what we can tell. And he had back surgery that went fine. So it's hard to understand. It's hard to see a personal grudge here. And it's more this philosophical view or completely corrupted view about the profit motive and about the evil of the American healthcare system, which is basically built on lies. Scary times, I think. The idea that people in New York and other places are seeing wanted signs for executives. I mean, there is the anti-capitalist mentality, the anti-capitalist view, the hatred of the profit motive is strong right now in America. It is strong in America. And how we're going to overcome this, how we're going to change it, how we're going to survive the next period of envy and hatred, I'm not exactly sure. We will have to see how that goes. But as I said, I don't think this is purely a left-right thing. I think that, as you know, I think people both on the left and the right are pretty anti-capitalist and anti-profit motive. This is a deep cultural thing that resents self-interest, that resents capitalism, that resents profit, that sees the world as a zero-sum game. And there's nobody today with a large audience trying to dissuade people from the idea that the capitalist economy is a zero-sum game. Somebody has to do that work.